So what we're going to look at now is the contractile aspects of the knee. I'm going to start anterior, then move medial, lateral and posterior. So with the anterior ones, we'll start with rectus femoris. Rectus femoris originates from the anterior superior iliac spine, which is here, and the anterior part of the iliac crest. And that's the anterior head. It also has a posterior head, which originates from the groove superior acetabulum. And it comes down and inserts to the patella via the quadriceps tendon and the tibial tuberosity through the patella tendon. This is a hip flexor and also a knee extensor. So what we're going to do to palpate this, I just want Derek to bring his knee up towards himself. As you can see clearly the muscle belly is popping out there. So do that again for us, Derek. Yeah, and this will help differentiate between the other quadricep muscles. Then we'll move on to vastus lateralis. Vastus lateralis originates from the greater trochanter, which is here, and the trochanteric line comes down in the lateral aspect of the linea aspera, and it inserts to the same as the rectus femoris. I will say the vastus medialis and vastus intermedius also inserts there, so I won't say it again, repeat myself. So the vastus lateralis is a knee extensor also, so if you can just kick your foot out for me there, Derek, relax. And bring it back out. As you can see, here it is here, and then this area has where the tensor fascial lata sits. So that's vastus lateralis. Then we want vastus medialis. Vastus medialis originates from the trochanteric line of the femur and the medial aspect of the linea aspera, all the way down to the medial supracondylar ridge of the femur, and that again inserts in the same place. And that is a knee extensor also. So if you bring your leg up again, Derek, as you can see, we can locate the muscle belly here, which is the teardrop, and it's coming up to the origin there. Then we've got vastus intermedius. Can't really palpate vastus intermedius because the rectus femoris sits on top of it and it's a strong muscle belly there. But vastus intermedius originates from the posterior lateral aspect of the femur and inserts to the same what we've just mentioned previously. So that's the anterior muscles. Now we'll talk about the medial. We've got the sartorius and gracilis. Sartorius originates from the anterior superior iliac spine and comes down and hugs the vastus medialis all the way down to the medial aspect of the tibia, otherwise known as the pes ansernius tendon. And what this does is this laterally rotates the hip and also flexes the hip, but also flexes the knee also. So how I would palpate this, I would rest my hand just where I would think the muscle belly is, and I would ask Derek to bring his ankle to his knee. Yeah, and relax again, do it again. Yeah, and definitely feel that muscle body contracting. And if you bring it back up for me there again, Derek, and if you just want to bring your knee towards you. Yeah, so we can locate that muscle belly there. And that's sartorius. Then we've got gracilis. Gracilis originates from the inferior pubic ramus, and it comes down, it's the most medius part of the muscle, and it comes down and inserts to the pes ansernius again. And what that does is that flexes the hip and also flexes the knee. And to palpate this is, we'll get Derek to I'm just going to put my leg there and resist him bringing his ankle towards him, and what we'll try to do is we'll be able to palpate the semitendinosus tendon, and we'll move medially and anteriorly to find the gracilis and sartorius tendon. So if you just want to bring your knee to yourself there, Derek. So that's a semitendinosus. I'm sliding medially, anterior, and I can feel them tendons and relax. I'm going to move superior again and contract again. Yeah, I can definitely feel that muscle belly there coming all the way up to its origin.